Thank you, Congressman Jackson, and thank you, Congresswoman Shontel Brown. Thank you to our CBC colleagues for speaking tonight on this important topic and for the incredible work you do on so many issues impacting our communities. National Diabetes Month is a call to action. It is a call to action to invest in our people, invest in our neighborhoods, and invest in public health and medical research. It's a call to take the simple and direct actions that are often right in front of us. Just a few weeks ago, President Biden declared November to be National Diabetes Month. And while diabetes is truly a widespread problem, it is also a disease that shows some of the deeper sicknesses of America's history. Roughly 1 in 8 Black Americans has diabetes, and nearly 40% of the population that doesn't have diabetes is already pre-diabetic. And it is not just an older person's disease. In the last 2 decades, the prevalence of diabetes among people under 20 for Black and Hispanic Americans has increased by 95%. When you add it all up, Black Americans are 60% more likely than white Americans to have diabetes. In Cuyahoga County, which I represent, the Black diabetes rate is 25%. For whites, it's 7%. When the CDC released the census data track, it showed there were neighborhoods in Cleveland where the diabetes rate was nearly 40%. And we aren't just more likely to have the disease, it's also hitting Black people much harder. Nationwide, we are 2.5 times more likely to be hospitalized by diabetes than white Americans, and we are twice as likely to die from diabetes. There's a lot that's broken here, and it doesn't have to be this way. 3 years ago, as a member of the Cuyahoga County Council, I helped lead the effort to pass a resolution declaring racism as a public health crisis, and diabetes is one of the indicators we pointed to. It's so many systemic and structural factors, the legacy of Jim Crow and slavery, poverty, and a lack of opportunity, denied access to health care, a lack of doctors and nurses from our community that can hear us and listen to us. It is so many different factors all coming together to produce a disparate impact. And in so many ways, this is the same story we see repeated with Black maternal health and other racial health disparities. Unfortunately, with diabetes rates this high, it's having a cascade effect on our overall well-being because diabetes is expensive, chronic, and potentially deadly. We just saw this with the pandemic. 4 in 10 adults who died from COVID-19 also had diabetes. But step 1 is identifying the problem, and that's why we're here this evening. Step 2 is action. We have real progress to celebrate thanks to the Inflation Reduction Act, which established a $35 per month cap on insulin costs for those on Medicare. And in response to the IRA, Eli Lilly and other pharmaceutical companies also announced price caps and price reductions for people with non-Medicare insurance. And not a single Republican in either chamber voted for the Inflation Reduction Act. But Democrats in Congress and the Biden-Harris administration stepped forward to deliver anyway. And just about every week, there's another effort by House Republicans to repeal some part of it. But the IRA is here to stay, and Black Americans are benefiting from this law. The IRA is lowering health care costs for seniors across the country and saving many of our constituents hundreds of dollars a year. While the data around diabetes is alarming, the Inflation Reduction Act shows that we don't have to accept the unacceptable. We've got a lot more work to do to address diabetes and public health disparities more broadly. The stark disparities of diabetes, those were centuries in the making. We can't change the past, but we can build a better future. We need to make healthcare more affordable, from drugs and treatment to coverage. We also need to ensure that healthcare providers look like America and look like the communities they serve. We need to help train the next generation of Black medical professionals. We need to invest in SNAP and WIC so people can afford healthy food. And we need to invest in and fully fund NIH and CDC efforts to study diabetes and treat diabetes so we can improve care. The budget fight we have been fighting for the past 6 months shows where each party is aligned and whose side they are on. If we cut funding for SNAP, push more people off of Medicaid, continue to cut investments in public health, and forbid every federal agency from even using the words equity, diversity, and inclusion, we know exactly what will happen and who will suffer. The stakes are clear, and my CBC colleagues and I are going to keep fighting for our constituents. Let's fight diabetes and help every American live a healthy life. And with that, I turn it back over to you, Mr. Jackson. Thank you.
I would like to